chronic smoking is one of the major risk factor, and then excessive alcohol intake, and then other things like we're eating lots of carbohydrate food, processed food. We eat excessive salt. Do you know how much salt is recommended to eat? It is 4 grams in a day. How much we eat? Like we eat around, insulin will put all the sugars into your cell. But if you have too much of fat in your body, insulin can't able to put all the sugar into the cells. So that excessive sugar is called diabetes. Around 200 patients has died because of the vaccine-related complications. But anything can happen at any time, but controlling risk factors is very, very crucial.
Dr. Sandeep Buddha is a neurophysician working at North Bristol NHS Hospital. He's specialized in stroke. He's a lead for stroke research delivery and also trustee for Bristol After Stroke charity. Dr. Buddha is a senior research associate at Bristol University and completed long walks, 106 kilometers, and ran a half marathon to raise funds for Bristol After Stroke charity. Let's get into the facts of the brain and its episodes. Thank you. Welcome to the Impact Show.
Welcome to the Impact Show. Thank you for being here. I would like to ask the first question, since we are the Impact Show, what impact do you want to create?
I'm, as you mentioned, I'm Sandeep Buddha, one of the stroke consultant in North Bristol NHS Trust, which is based in Bristol. So I work in a stroke. So the major aim for me to do this Impact Show is to create awareness about stroke and then talk about generalized diseases which involves brain and obviously like heart and general things.
I know this is going to be a generalized question, but can we go into the basics first before we move on to the speciality? Can you explain what a stroke is and how many types are there?
So basically the stroke is the Latin word which means sudden, which means like a thunderstorm.
Oh, okay.
So anything happens to your body suddenly, they call it as a stroke. So normally that's what they used to think, like if you collapse suddenly and whether because of the brain or because of the heart, we call it as a stroke. You might have noticed in some certain countries, the stroke means heart attack. And but in UK, like most of the Western countries, the stroke, we call it as happens to the brain.
Correct.
So the literally stroke means which happens suddenly.
Okay.
So as I said, like in the medical jargon, the stroke always refers to the sudden onset of damage to the brain, and that's called brain stroke. Like as I said, even if you have a collapse, sudden onset of damage to the heart, you call it a stroke. So we stick to the brain because I'm a neurophysician.
Yes.
And then the stroke, as I said, the sudden onset, if the damage happens, because the damage happens because of the blockage of blood supply. That's a kind. There are two kinds of strokes. One is a blockage of the blood supply because of the clot. That's called ischemic stroke. And the other one is rupture of the vessel, blood vessel in part of the brain is called hemorrhagic stroke. It's called bleed. So out of these two kinds of strokes, 85% of the strokes are secondary to the blockage of the blood vessel. And then the remaining 15% is because of the rupture of the vessel. So these are the two broad difference between the two kinds of strokes.
Yes, thank you. Yeah, when I was in India, I was in impression because usually in India they call even for the heart related as a stroke. So I thought they were wrong, but you explained it very well. Thank you for that. What are the primary causes for a stroke? I know still it's a broad one, but if you can generalize.
Sure. So as I said, ischemic stroke is quite common, which is blockage of the blood supply. So brain, why we are worried about brain is because obviously if you look at the statistics, the most common cause of death in the whole world is because of the heart attacks. Because of the block, again, that's because of the blockage of the blood supply causing a heart to stop is a heart attack. The second most common cause of is brain attack, which is brain stroke. So obviously we know that heart is important, and at the same time brain is important. So these two organs are vital organs. Without that you die,
Yes.
obviously. And so that's why it's got lots of importance in terms of coming back to what caused the strokes. Like as I said, 85% is ischemic strokes, which is because of the clot in the blood vessel. So what happens is, if there is any blockage of the blood supply to that particular part of the brain, that particular part will die. So that causes disability, which means if one part of the brain is affected, you got disability, which means brain controls everything, controls how you talk, and controls how we see things, controls the movement of the arm and leg. So everything is controlled by brain. So if you have a damage to a particular part of the brain, you lost that particular function.
Correct.
For example, if you have a damage to the speech centers, so you lost speech. If you damage to the arm function, you lost function of the arm. So that's why it's quite important. So the blockage happens because of the clot, blood clot. So that's 85%, and the remaining 15% is because of the rupture of the vessel. Because most common cause is high blood pressure, which means if they have a high blood pressure, it causes a rupture of the vessels, causing a bleed. And then coming to the 85%, which is clot. Again, why people get the clots, that's quite a big thing. Different causes for the clots. The most common thing is there is a clogging of the vessels. What you call is wear and tear of the vessels, causes narrowing of the vessels. In other words, we call it as atherosclerosis. Like, the blood vessels gets narrowed because of the wear and tear, or because of the chronic conditions, which happens because of the hypertension, high blood pressure, and high blood sugars, abnormal blood sugars. And then these are all risk factors, what you call.
Yes.
If you smoke quite a long time, like, chronic smoking is one of the major risk factor. And then excessive alcohol intake. And then other things like, high cholesterol in your body. So these are all the risk factors causing a blockage, formation of the clot, and that cause strokes. And the other common things is if the clot come from the heart, which is quite common, which means if the heart, obviously the function of the heart is keep pumping.
Correct.
If it's not pumping effectively, that forms clot in the heart. So that clot go up into the brain, causing a ischemic stroke. So that condition is called atrial fibrillation. So in obviously in Western countries you see quite a lot of atrial fibrillation, which is quite common. But interestingly, in Asian countries, South Asian countries like India, we see lots of atherosclerosis. Like developing countries, you see lots of atherosclerosis, which means wear and tear or clogging of the vessels.
Yeah.
But here, atrial fibrillation, irregular heart rhythm, is the major cause for the ischemic strokes, for the clots formation.
Is there any lifestyle related or particularly diet related? You mentioned Western people, they get more atrial fibrillation. Is there any particular reason?
Like, see, obviously the same risk factors what I mentioned applies to the heart also.
Yes.
So the heart, because of the clot formation, because of the blockage of the vessels, which is called atherosclerosis. So it's all, that's why they call it, both are important, the same pathology. What you call is cerebrovascular disease, which means cerebral means brain, coronary vascular disease, which means heart. So it's both a vascular disease, which means vessels are affected, the pumping brain, the vessels are affected. So in 1961 or 65, around that area, in US, they've noticed that lots of people are dying because of the heart attacks, and lots of people are dying with strokes. So American president wanted to make a medical opinion, medical panel to find out why people are dying. So in that, interestingly, they found out that everybody is dying because of the blood vessel clogging of the vessels, which means atherosclerosis. And then they found which means, what does it mean is deposition of the cholesterol in the vessels. So they found, okay, if you eat lots of cholesterol, you're going to get deposited in the blood vessels, so that causes blockage of the blood supply. So they thought, okay, so we have to fight around not to eat cholesterol, because they realized that if you eat excessive cholesterol, you're going to get a clogging of the vessels, like blockage of the vessels, whether the heart or to the brain. So they thought, okay, we'll stop reducing the levels of cholesterol all over the world. So that impact has caused lots of changes in the whole food industry.
Correct.
Which means everybody started saying that, oh, we got a 0% cholesterol, we got a negative cholesterol, less cholesterol, oil, foods and everything. So in the food cycle, what happens is, what we eat is obviously carbohydrates and proteins and fats, lipids. So these are and the other things is minerals, but these are the major ones. And out of which major portion is around 40 to 60% is carbohydrate, and then 20% is the protein, and the remaining 20%, 10 to 20% is lipids, cholesterol. So that's our food cycle is. So if you want to reduce the cholesterol levels, so we have to, in the food cycle, we have to eat something. You can't live without any food. So automatically the cholesterol, the lipids, like the carbohydrate level has gone up. So what does it mean is we're eating lots of carbohydrate food, like or processed food. So that's a basic food industry had made in such a way that they're trying to reduce the lipids. But now in the 2000, we realized the cholesterol has gone up is just not because of the cholesterol, it's because of the carbohydrates. So because we are increasing the levels of carbohydrates and decrease because everything is important. You can't just stop cholesterol or stop lipids completely, because the cell wall is made up of lipid. If you don't eat lipid, that's caused bleeding and other complications. So we have to have everything in your food cycle, and out of which unfortunately the carbohydrate levels has gone up compared with the protein and lipids. So now they realize, oh God, okay, we have to cut down the carbohydrate levels. So they're trying to cut down the carbohydrate levels and then increase the protein levels. That's good, but again, as I said, it's all balance. We can't just say this is good, this is bad.
Correct.
Everything should be in balance. As long as you're in balanced diet, you shouldn't be having another basic misconception about lipids is we all think that if you eat lots of cholesterol food or lipids, you're going to get a high lipid. It's not like that. Even if you eat carbohydrates, everything changed to the lipids. Everything changed to cholesterol. So if you eat too much, that excessive food is stored as a lipid or cholesterol, as a fat in your body. So it's not about lipids or cholesterol or fat. It's about everything, the food what we eat, and then how you expenditure. Like if you eat this much of food, your body, if it doesn't need that much of, the calories we normally need. As a men, we need 2,500 kilocalories per day, and the women we need around 2,000. But body itself, for regular functioning of the body, we need around 1,000 kilocalories. The rest of them is used for when you walk, when you do exercise. But if you don't do any of all these things, the excessive calories what we eat is going to store as a fat. So in a logical way, you have to eat less and do work more. Or if you eat more, just try to burn that extra calories by doing exercise. But these should be long term, not it should be consistent. It's not like doing one day in a day and this kind of stuff. So coming back to your question about what are the risk factors. So the food industry is one of the major things that affects your body, obviously, because if you eat too much and that stores as a fat, and that causes metabolic syndrome. Metabolic syndrome means excessive, you get more obese, and the excessive fat deposits around the liver and then around the tummy, and that causes obviously more risk for formation of lipids or fat deposition around the vessels. So that's a logic. So you try to reduce the amount. So secondary to that, that causes high sugars, obviously. If you have a high fat in your body, the insulin produced by, normally what happens is insulin is a hormone try to put all the sugar into the cells. So whatever you eat, once you eat anything, the insulin will be produced. So the insulin will put all the sugars into your cell. But if you have too much of fat in your body, unfortunately insulin can't able to put all the sugar into the cells. So that excessive sugar is called diabetes. So you get diabetes. So if you get diabetes, that fat and diabetes causes deposition along the vessels, so it's called atherosclerosis. That's one thing. Second thing is high blood pressure. But most of the times you will see obesity and all this stuff cause high blood pressure, but some genetic factors are also there. Like for example, if you have a high blood pressure in your family, you tend to get a more of high blood pressure.
Correct.
And this coming to the high blood pressure, there is an interesting study which is done in people those people who are our ancestors, quite old hunt gatherers. They found out, they looked into all the vessels in those people, like I'm talking about 1,000 years, 20,000 years, like 2,000 years ago. And those found out all the vessels in those bodies, and the vessels are very crystal clear. So they haven't got any vascular disease. But why these all happening now? So which was one of the factors is salt. So we eat quite excessive salt. Do you know how much salt the World Health Organization is recommended to eat?
No, not sure.
So normally they recommended around at least 4 grams in a day. But do you know how much we eat? Like we eat around 12 grams.
12, okay,
in a day. In a day,
okay.
So it's quite heavy. So that excessive salt, what happens? Because of the salt, it absorbs lots of water. It's a solvent. It absorbs lots of water. Then if there ever lots of water in the blood vessels, that pumps up. So that causes high pressure. That's called hypertension. So first thing is cut down significantly amount of salt to reduce the blood pressure. So blood pressure is one of the factors.
Correct.
Diabetes we talked about, and then excessive cholesterol like fat depositions. So these are all common factors. And again, you know that cigarette smoking. And then excessive alcohol intake. So these are all factors which cause atherosclerosis and the leading to the clot formation. And then the other thing is about bleed. I was talking about high blood pressure. So again, high blood pressure is, unfortunately, I've seen lots of young people, they don't realize that they have a high blood pressure. Because we always think that high blood pressure causes dizziness. And unless you get dizzy, you don't get checked. Like obviously it's common sense. We don't want to check the blood pressure. But there are lots of blood pressures which is not symptomatic without knowing anything. So it goes up in your body. So we need to keep an eye on it. And if it's high, obviously we have to start on medications to control it. Because once it goes up, unfortunately the vessels can't able to maintain that pressure. If the blood pressure is normally 120/70, if it goes up to 140 or 180 or 200, it bursts. Simple logic is. So similarly, if it bursts in the brain, you get a bleed, which is called a kind of stroke, ischemic bleeding stroke. So that's catastrophic. Like 85% of the people die if you have a bleeding brain, basically. So it's a very catastrophic condition to have.
Thank you. From your experience that you've been with NHS a few years, is there any particular age group or a particular race that they are more inclined for stroke?
Like previously, we all used to think that the stroke is an old age disease, which means people, if they get older, you get strokes because the blood vessels get blocked up and then cause rupture of the vessels and all. This all happens in old age. But nowadays the trend is changing. It's not in the whole world. More and more young people are having metabolic syndromes, obesity and hypertension, and then these risk factors like smoking and then alcohol intake that caused incidence of strokes in young people is relatively very common nowadays. We come across quite a lot. Even we see 18 years, 17 years having strokes, and then but there might be other reasons for it, like not only the ones which I mentioned it. But if you go to the South Asian countries, people are having more incidence of hypertension, more incidence of diabetes, and then obviously they're prone to have a vascular risk factors with smoking and alcohol intake, and then even the drugs. Drugs is quite common in a younger age group, and that can cause lots of incidents of ischemic strokes or bleeding.
Thank you. I guess you answered my next question already about the preventive measurements, because we talked about food industry, high blood pressure, smoking, excessive alcohol.
So I just want to highlight one point is basically the medicine or health as such divides into two aspects. One is health related issues or medical related issues. So if you get a disease, it's a combination of these two things. The difference between health and medicine is health is controlled by the other things not in your hands, like environment and
genetic.
Maybe genetic, it comes to a particular thing like environment, water. So obviously if the pollution of water, it relates to health problems. And then environmental toxins and related to the health problems, like even accidents. So these are all related to health issues, which is not in your control, like in a clean environment, and because of the mosquitoes, you get all the viral infections or whatever, or communicable diseases. And coming to medical bit is in your hands, which means what we talked about, all these health related food habits, and then some of them are genetics. But again, the diseases are divided into 5 types. One is obviously genetics, which you can't have in your control, because if you have a genetic problems, you born with some kind of genetic disease. And the other one is about autoimmune disease, allergy reactions, which means it all happens because of the toxins, and the body immunity respond to the toxin causes some kind of autoimmune diseases, like you might have heard about myositis. And then nowadays there are lots of autoimmune disease in younger age groups, rheumatoid arthritis and all this stuff. And then next thing is about your cardiovascular diseases, like the metabolic diseases, what you call, we talked about atherosclerosis and all this stuff. And the fourth one is communicable diseases, like infections, like it's come from the bacteria or virus, and
or from
other things. And then the fifth one is cancers. Obviously, this is quite interesting topic now. Everything, the incidence of cancers is going up. So these are all different kinds of diseases happens. Some are controlled by the health related environment, and some are controlled by your internal, like as you said, the genetic diseases and all this stuff. So it's a combination of things which affects you.
How has stroke treatment evolved in recent years? What are the most promising new treatments available?
So stroke, as I said, the most 85% of the clots. So the simple logic is, if you try to take out that clot immediately, because it's a simple logic, like if you block some blood supply, like if you're blocking the pipe, that we don't get water. So what we need to do is we unlock that blockage. Similarly, we have to take the clot out as soon as possible once we find the clot. It's a 1995, that's a revolutionized management, in the sense until 1995 there is not much of treatment until you give some aspirin to prevent clot formation, but no treatment available to take the clot out immediately. So 1995 there's a wonderful NINS trial has shown up. If you dissolve the clot immediately, because if you delay things, like they're given 3 hours to 4 hours. So if you give that clot-busting drug, what you call, and immediately within 3 hours to 4.5 hours, we can dissolve the clot, and then we can prevent damage to the brain, so prevent completely stroke. So that's a revolutionized the management. And then in 2015, similar to the heart, so what we've done is we put a catheter into that blockage part of the brain and then take the clot out. Because sometimes this injection may not be able to dissolve the whole clot, so we have to manually go there and then take it out. That procedure is called thrombectomy. So that's revolutionized that management of stroke quite dramatically. Same like heart. If you see any heart blockage, heart attack, you take it out, and sometimes you put a stents also. So these two managements, thrombolysis and thrombectomy, has revolutionized the management of stroke, especially ischemic strokes.
I want to talk a little bit about paralysis. What particular part of the brain, when it gets clotted, that causes paralysis? What particular part of the brain?
So, like as I said, it's the clot can go to anywhere, like left or right. The left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body. But the left side has got speech centers, which means if you have a clot in that particular part and you lost speech, left side only. But again, in either side, if you have a particular part, like what you call internal capsule, that particular part is affected, you lost arm function and leg function. So it's called paralysis, you disable with all the paralysis. But there are lots of other things. What we see externally as a layman, we always see is paralysis, the arm and leg, but other things like visual disturbances, you can't see it properly, that's also kind of stroke. If you can't able to get the words out properly, or if your speech is slurry, that's called dysarthria, that's also kind of stroke. And sometimes you get severe headache, and that's also part of the stroke. And then like classically what you said, we see arm and leg weakness, but sometimes balance, like if your balance is not right, that's also part of the stroke. So the lots, it depends on which part of the brain is affected. So that's why we advise all the people to respond immediately to the hospital. Depending on the FAST sign, you might have heard FAST. FAST means facial weakness, arm weakness, speech disturbances, and then if you have those symptoms, you have to call, time is important. Correct. Time is brain. The interesting point is, if you wait for 1 minute, there are 18 million cells is going to die in your brain.
Wow.
So 18 million cells. So 1 minute, what you call is, we normally call it time is brain. So if you waste more time, you're going to lose more cells and cause more disability. So time is brain, get into the hospital and get these medications as soon as possible.
Okay, that's FAST.
FAST. And then they've included more into the dizziness and visual disturbances. So these are all stroke symptoms. You have to pick it up immediately.
Thank you. Thank you for that. Is tinnitus and stroke, is there anywhere related? Is it a possibility if you have tinnitus that you have to look out that you're not under the risk of stroke? Is there any?
See, like the first point I mentioned is stroke is always sudden. And then you may collapse, or you just suddenly happens, and that's severity. That's why they call it a stroke. So tinnitus is, if it happens suddenly and if it's unbearable, that's because of the stroke possibility. But most of the tinnitus, what we see in our general population is chronic. It's not just happens like that. It's been going on for a long time, but for a while, few days. So those most common tinnitus what we come across, they're not stroke related. That's related to the other problems like degenerative diseases, in the balance problem, like in the inner ear. So you get those symptoms like tinnitus.
Correct. What is a secondary complication? Because for this research, for this interview episode, I was going through a few journals that I heard that a stroke survivor can get possibly another stroke in 5 years. Is that happened in your from your experience? Have you seen it?
Like it's again, the basic thing is, if you find out why people had a stroke, what is the reason for it, and then, like as I said, is it because of the high blood pressure, is it because of the diabetes, and is it because of the as I mentioned, atrial fibrillations, which means irregular heart rhythm, and anything else. That's the important point. Is, as a physician, we need to find out, as a patient, we need to find out why you had a stroke, or why everybody has had a stroke. If you find out the cause and if you treat that cause, then the incidence, we reduce it quite dramatically. But if you don't know why exactly people happen, for example, if you say, okay, you got a wear and tear of the vessels, like lipid deposition, but if you still carry on doing, you become obese, and then your diabetes is not controlled, your hypertension is not controlled, then obviously you're going to get a further stroke. So that's a common thing. Similarly, atrial fibrillation, the treatment is to thin the blood, to prevent clot formation. If you don't treat that, then you're going to get further strokes. So there is an incidence of having a further strokes, but depends on what is the caused it, what the etiology of it, and how do you prevent that. That's important.
Yes, yes. Thank you. You're into research as well. What areas of stroke research are you most excited about in terms of advancing prevention, treatment? So what are the most excited things in terms of?
Like when I was in India, I was really like, because as I mentioned, 95 there is a drug come up in the market. It's called clot-busting drug. It was very expensive. Like in India, obviously money matters back home, and then there are lots of people couldn't able to afford it. I think luckily there is another biological version of the drug called tenecteplase has come up in the market, and it's quite relatively cheap, and we can give it one shot dose. So I have used it quite a lot. Like we started on, like that's come up in the market in 2015. So that we use quite a lot in India. That's a wonderful advantage with that, because it's relatively cheap and it's easy to administer, easy to give it. So that made a relatively good impression for the people, so that they can have some medications to get the stroke treated. So that's published in one of the American Neurological Society publications about that drug. That's again we try to implement in UK, but they still, because of the logistics of getting the medications, but hopefully in the future we used it, but the drug is not available, but we're trying to get that medication. So that's revolutionized a bit in terms of management point of view.
But that is available in India?
Yeah,
right
absolutely.
Now. In any other countries?
They used it in Japan, and then Australia they're using quite a lot. So some of the countries they're using it, but Indian,
not
obviously
in Europe.
Not in Europe also they're using, not much as compared with the rest of the world.
Okay, sure. Are there any misconceptions or any myths about the stroke that you want to address it and clarify?
So obviously, like as I said, the first misconception is stroke is why is it a heart stroke or brain stroke? That's a common thing. And the second thing is, whatever it is, when you have a neurological symptom, sudden neurological symptoms, always try to get to the hospital as soon as possible. That's important, because if you neglect it, you're going to lose that arm or leg, you become disabled. So that's quite catastrophic events. And then before like people always think that why should I get stroke, and it's all about old age, why I'm so young I shouldn't be getting the strokes. So that kind of myth has gone now, because anything can happen at any time, but controlling risk factors is very, very crucial. There is a interesting analogy, I always use it when the people see, for example, if you say there is red lights, traffic red lights, people always has to follow traffic rules, which means if you have a red light, you have to stop it. But sometimes people ask me, if you cross the red line, what happens? Like, but nothing happened. You may not die. You probably get on with it. Like you miss the accident and you get on with it. But for example, if you have a trouble with your bikes, which means if you have one risk factors like hypertension, there is a bit more chance that your brakes may not work while crossing the red line. So you could, and for example, if you have a trouble in your tires, like the air is not filled properly or something, like for example, if you have a second risk factors like diabetes, you still more prone for a accident. And if you have a trouble with the engine itself, so you're still more prone for it. So if you have more risk factors, you're more prone for accidents. So never think that you never get any disease. Anything happens, as long as you control your risk factors, so the chances of having a disease or stroke, whatever it is very minimal.
Sure. I've been listening a lot about COVID vaccine in the recent days, I think in the last 2 or 3 days. The side effects, especially related to the COVID vaccine. And I do know that you participated in a research trial for the COVID vaccine. Can you throw some insights about your experience and what you did?
Yeah, that's quite interesting. As you said, it's quite recently that AstraZeneca has mentioned that they have noticed, obviously, lots of side effects. So they said clots, and but that in fact we, as a part of the UCL, like University College London hospitals, we from Bristol we noticed some patients who had died because of the complications after the vaccine. So in that team, we collected all the patients in whole of the UK. So nearly, I think, if I'm not wrong, around 200 patients has died because of the vaccine-related complications. But interestingly, all the majority, even 90% of them has had clots in the veins. So which is related to the brain, like until now we're talking about the blood clogging of the vessels, lipid deposition of the arteries, not in the veins.
Okay.
So the veins are very subtle, small ones, but again, unfortunately, those people has had because the AstraZeneca vaccine, they've used some kind of adenovirus, which is common cold virus. So their body immunity has reacted to that virus, causing a low platelets. And then if it's have a low platelet, there is a tendency to form clots. So that clot blocked the venous sinuses. So causing death in most of the times, or bleed in the brain also. So that's quite catastrophic. But coming to the but it's very rare, like 200 out of million doses they had. So what I'm trying to say is the incidence of side effects is very minimal, but it happened. It happened with AstraZeneca. Even in fact, they have agreed for it. But that is not a kind of stroke, that's venous clots causing a bleed. So it's a very rare kind of stroke, but it's very compared with the advantage of having vaccine is much more than the side effects we noticed with AstraZeneca. But fortunately, it's not noticed with other mRNA vaccines like Pfizer vaccine and Moderna vaccine, those kind of stuff, but definitely noticed with AstraZeneca.
Okay. So the reason for their death is venous clot. So that's been proved.
Venous clot causing low platelets and then stroke-like symptoms.
Yes.
But it's a rare kind of stroke. It's not like common strokes what we come across, like arterial diseases.
Yes. Yeah. Thank you. Finally, how our audience can get in touch with you if they are interested to know more about stroke or other stroke-related issues, health issues. Do you have a website, or do you maintain any Facebook or Instagram? How can they reach you?
As NHS doctors, we don't do that stuff. But again, they can contact me via your show, probably, or I can forward my personal email to the show.
Sure, we can publish that, yes.
And then if they're interested, they can come across via that email.
Sure. Is that a legal obligation that having, you said NHS?
Like, because we have to, if you're doing any commercial aspect, we have to mention to the NHS team. But if you're not doing any, if it's a charitable trust, charity related issues, I shouldn't be any trouble.
Okay, sure. Yeah. Thank you so much, Dr. Sandeep.
Thank you. Thanks, sir.
Thank you.
I learned a lot. What about you? Please comment underneath, subscribe, and share it with your loved ones. Stay tuned to The Impact Show. We'll come with more interesting episodes next time. Until then, ciao.